Well, welcome to our 8th and final session of the Flourishing in Medicine series. This one today is titled Transforming Health Systems, Organizations, Leadership, and Vision. What we hope you'll get out of this is a sense of the overall arc of this course and how this can actually lead to real change within your own clinical practice experience as well as the institution or organization within which you work. So the learning objectives are many. We'd like to kind of pull it all together today, describing the qualities of well-functioning mindful organizations, exploring the sources of stress and distress in those organizations, and sharpening your skills to be an effective leader. You know, all of us in one way or another are in leadership positions. Whether you see yourself that way or not, people do look up to you. So sharpening those skills is going to be one of the things we're going to explore today. Also connecting with others in your organization with some of those qualities that we talk about throughout this course, the attentive observation, curiosity, beginner's mind, and presence. To accept and learn how to thrive in the reality of our work, which includes uncertainty, unpredictability, and very frequently very little control. And then finally, to describe how these qualities of the Mindful Practice program can help you understand and lead small teams, larger organizations toward greater health and flourishing. So let's first start with a review of the practice from the last session, the gratitude practice. If you remember, we invited you to begin, say, each week writing down 3 things that you were grateful for. And then at the end of the week, if you had a time or a chance to look back at those list of things that you were grateful for and see if that made sense to you, if you were still grateful, if there were new things, other things. So how has this reflection affected your work? Think about some of the things you may have been reflecting on, being grateful for between last session and this session. And just that acknowledging, naming, writing down, reflecting on those things, how has that affected your work? And engaging in a practice like that, what has it been like to go to work that first day of the week, whatever day that is, Monday for many of us? What was that like for you, having spent just a few moments to reflect? And then what does it feel like to complete the end of the work week, having held those at some level of awareness throughout the week, looking back and reflecting on those? This is certainly something you can continue to bring into your work life as a way of looking at some of the potentials and capacities and successes that are actually present in your work already. So I'd like to talk a little bit about what are some of the next steps after you complete this 8-session program with us. We offer a number of different programs if you are interested in furthering your education and having deeper experiences with the Mindful Practice in Medicine program. We offer workshops. We have half-day workshops that are online. We have online and live in-person residential 4- and 5-day trainings, teacher trainings if you'd like to learn to facilitate your organization or your team with some of these ideas and techniques. We offer consultations to practices, healthcare organizations, institutions, hospitals, medical schools, residency programs. We provide you in your workbooks, in the curriculum that you receive, a series of references as well as all of the practices that we have shared and practiced together with you, as well as other resources, a bibliography that you can refer to. And then there may be people in your community who have participated in this program, both this online program through the CME and also programs that we've given in the past. There may be communities of individuals who have also engaged in this with you. So I'd like to shift slightly. This is going to be a little bit different than what we've done in the past. You've had elements of this, but I'd like to take a little longer leisurely break here, a pause to formally practice awareness. So, however you are right now, just being aware of where you're sitting, how you're sitting. If you'd like to adjust your posture, if you'd like to stand up, you can do this standing. But place yourself in some sort of posture, standing or sitting, that's comfortable for you. And one that will kind of help you be present. We like to say, not get you so relaxed that you'll fall asleep, but rather that you'll be present enough that you'll fall awake. And I'd like you to start with just an awareness of the body. The body is this ever-present, we can call it an anchor for our attention. You know, you may have noticed that the attention tends to go all over the place. So just bring awareness to your body as a whole. Whether you're standing or sitting, feeling the weight of your body, the effects of gravity pushing your body into the chair or into the floor. It requires a little bit of letting yourself go physically. Maybe just scanning briefly through the body, noticing your feet making contact, your legs, your knees, if you're sitting there, the bend of the knee, which you can imagine as an image, but rather than imagining it, if you notice an image of your knee bent, coming back to the actual direct experience of sensations at that point in your body, the knees, your thighs, your buttocks, your pelvis, your spine and back, rising up from your pelvis, your shoulders and arms, head and neck. Perhaps bringing awareness to your breath, another way of anchoring your attention in the here and now. And you may have noticed as you're bringing awareness to the breath, your mind is probably, very likely, mine was, off doing something else, thinking about what's next or thinking about something that's happened. That's perfectly natural. That's nothing wrong with that. Your awareness is the key. Are you aware of that? Can you bring yourself back just to the breath again and again without judging yourself for having a normal human wandering mind? Noticing how you're feeling. What I mean by feeling in this moment is this pleasant? Is this moment sitting here or standing here unpleasant? Is it kind of in the middle somewhere, neutral? Are you a little bored? There's nothing wrong with any of those. Again, it's about cultivating awareness. Perhaps taking a moment now to shift the attention from the body sensations, from the feelings we have toward this experience, to actually the activity of the mind. It's a little bit of a strange thing to do, to say, ask yourself to be aware of thoughts. And it sometimes helps just to anchor yourself again in something like the breath. And I can almost guarantee it won't be long until you'll begin thinking. It won't be very long at all. Even the thought that, oh, I'm not really thinking of anything, that's just a thought to be aware of. And then bringing awareness to just your situation in your room, in your office, wherever you're watching this and sharing this with me. Noticing the surroundings, they're part of your experience right now. Good, thank you. So this is a brief contemplation. You could use this, you can come back to this slide alone, this part of the program alone, and use this as a guide from time to time if you'd like a little more lengthy contemplation way of practicing. So here's our Imagine slide again. This, by the way, is the tile mosaic in Central Park, what's called Strawberry Fields, right across from where John Lennon lived. Imagine. Let's imagine that a miracle happened overnight, like that. Your organization has become more mindful, pays attention to the right things. It is an environment that supports curiosity and creativity and helps patients and clinicians like you to move toward health and flourishing. Hard to imagine, but try. So if you jot down some notes, get yourself a pencil or pen and some paper and just write a few thoughts you have about how is that organization working? What's the way it's working in order to enable creativity and to help patients and staff and clinicians be healthier, perform better work, engage in higher quality care, and the experience of that care being also of high quality. And think for a moment that there may be some ways, even small ways, in which your organization already fulfills some of these criteria. And yes, it falls short, it's imperfect, it may be actually quite distressed, dysfunctional. We talked to you about this appreciative inquiry approach, and it allows us to find the things that are working. We'd like to capitalize on those, leverage those to create a future that's more workable. So thinking about qualities and features of your organization that's already there that seems to be supporting this way of being together. And then your role. How do you fit in? How do you support some of these qualities? How could you? How may you in the future? And also, how do you sometimes contribute, as we all do, to the dysfunction, to the failures? So consider what you might do in your position of leadership, however small, your small team, your practice, your department, your organization, whatever level you lead on and in. What might you do to create community, to make it more workable together? Think of something simple that you can do, and think about those who make you feel better about your work, who make you feel like you're in the right place, make you feel whole, we could say. Those with insight, love, wisdom. Include those who could possibly or will possibly challenge your worldview. In some ways, they're not your enemy. Remember, we talked about resistance that we run up against is the way in which we grow. They're helping you grow is one way of framing that resistance, that challenge. And even thinking of those who are not in that group, outside that bubble, the larger organization, the larger community. So we're going to come back to these qualities that we've been sharing with you and going over and applying to many of the pain points that we experience in medicine: errors, teamwork, suffering. We'd like to see how do they apply to the organizations, to the institutions, to the structures within which we work. So again, attention or attentive observation. Well, we can think about how aware we are toward the most important things, how the organizations are attending to the most important things, and actually measuring their progress, tracking, preventing, learning from failures, growing as an organization, being a learning organization. Critical curiosity, resisting simple fixes, oversimplifying, and really understanding and realizing the complexity of these systems and being curious about how complex they really are and what works, what doesn't work. Being realistic in some ways. And with beginner's mind, our organizations, we in our organizations can together question certain assumptions we made. Well, this is how it's always been done. Well, yes, but it's not really working. How about let's trying something different, even on a small scale? Taking others' perspectives, being really creative, seeing things freshly, imagining you're dropping in from Mars and you find this organization. How was this created? And what could be quite obvious as an outsider, to an outsider. And then finally, presence, this ineffable quality of when things are really in flow, right? How do these organizations, how can we encourage the sharing of our mind, of our ideas, of our expertise in collaborating in a workable way? Resilience together and freedom to act. So I'd like to hand it over to my colleague, Ron, who will take over the rest of the session today.
Well, thank you, Mick. So I'm just going to build on a few of these aspects of organizational mindfulness and then talk about why it's, if these are such positive attributes and organizations all should run this way, why it doesn't happen. And maybe that'll give us some insight into how our own awareness of ourselves and our communities that we can actually move forward. I also want to say parenthetically that we've worked with medical students, residents, other trainees in other health professions, as well as practicing physicians who are new to practice, people who've been practicing for years and years, as well as administrators and leaders, CEOs of organizations. And I'll say that no one is really happy with the way healthcare organizations run. Everyone finds the situations distressing, and no one really feels a sense of autonomy and empowerment. Even people at the top have to answer to various boards and other regulatory agencies. So this sense of distress within organizations is pretty universal. It's sometimes hard to see from your own vantage point how those who seem to be making the rules that you have to follow are also distressed. But I think it just really pervades the whole structure. So to the degree that you can feel some commonality with people at different levels of an organization, I think perhaps that might potentiate change. So you've seen this this image before. This is Prometheus, who was chained to a rock by his boss, who happened to be Zeus. Prometheus brought fire to humanity, and Zeus didn't like it. And every day an eagle would come and peck at his liver. And so I'm just going to list here, things that clinicians and leaders say peck at their livers every day when they're at work. And some of these things are kind of unavoidable. For example, healthcare always has been emotionally intense and unpredictable. Go back to the writings of Hippocrates, or in China, the Yellow Emperor's classic of internal medicine. They talk about this kind of unpredictability and emotional intensity and how we need to manage that. But some things are newer. When people practiced individually in solo practice and there weren't cell phones, the internet, or anything like that, the burden of distractions was really quite different. And that is only accelerated, and it's really forced us to multitask. And what we know about the human brain is that the human brain does actually not multitask. We actually rapidly alternate between different tasks, and there's always this latency, there's always this delay, there's always this recovery period every time we switch tasks. So multitasking, although we have to do it, and some people are more adept at it than others, multitasking has some inefficiencies built into it. Frequent interruptions, and not only interruptions by people, but interruptions by devices, alarms, notifications, what have you. Productivity and time pressures, computer systems that don't fit the way that the human brain works, meaningless administrative tasks that no one seems to be able to do anything about, just because of the chaotic structure of healthcare systems. But these last two, I think, are particularly salient now because clinicians more than ever are feeling that they lack control over the environment in which we work. And yet we're being held accountable and responsible for more and more and more things. So it used to be that billing was someone else's responsibility, and now clinicians have to not only master their own clinical skills, but also the intricacies of billing to maximize profits and what have you. So that constellation of low control and high responsibility is a formula for what's called learned helplessness. And then this sense of isolation, which is so much worse since the pandemic, but was actually starting before that, that primary care physicians no longer admitting to hospital, no longer rubbing shoulders with specialty colleagues, people charting in isolation as opposed to in a common area, people glued to a computer screen as opposed to being able to interact more in a more natural way. So this sense of isolation and lack of community is particularly salient. And so we just, why does it have to be this way? And if you think about, looking through a retrospectoscope about the evolution of healthcare in the US and elsewhere, one can see the logical progression of why the situation actually evolved this way. But do we need to actually continue that trajectory into the future? And that's the big question that we're all asking ourselves. Why must it be this way? Are there aspects that are unchangeable? But then questioning, well, are they really unchangeable? And what would it take to make a difference? So this Tate Schoenfeld and his group at Stanford have developed this really simple and I think elegant framework of wellness. And I see it not only as individual sense of well-being, but also a collective sense of well-being, organizational well-being. In the short run, organizations and individuals might be pitted against one another. But in the long run, obviously that doesn't work. You have more attrition, you have more shortcuts, more inefficiencies. So what we're going to be looking at here, in the previous session, we looked at the whole issue of personal resilience and how we build that. And that's incredibly important, but we also need to have the time and space to be able to do that and the freedom to act. So the time and space people, part of the equation really sometimes boils down to efficiency. Are we actually able to do our work in a way that actually is reasonably efficient, or are there things that are just blocking us from doing that at every juncture? And then the culture of wellness, one thing that we do know about resilience is that even in the most horrible and harsh environments, if there's a strong sense of community and a sense of purpose, people are actually able to move forward. Work has been done in refugee camps, concentration camps, the most dire of circumstances, and people who are able to maintain a sense of identity, a sense of purpose, and a sense of meaning are really able to move forward. So that culture of wellness that reinforces the value of each human being as part of an organization is incredibly important. And you might want to reflect on the degree to which your organization respects and values you as an individual, and also the degree to which you as an individual are able to express your respect and valuing of other people in the organization. So Mick alluded to the fact that we are all leaders. If you're a third-year medical student, a second-year medical student looks up to you. And so leadership is not bounded by titles or ranks. If you think about infection control in a hospital, just consider that whole realm, okay? Now there's probably someone who sits in the C-suite who has responsibility for monitoring that. But who's really leading the effort in terms of infection control? It may be the environmental services people, the people who clean patient rooms. What's their culture of wellness among the group that they work with? Are they really astute to potential threats to patient safety? And I know that people who work on the unit that I work in the hospital actually are. They actually do point out such things, and their voice is actually heard. So that we can all make a difference, and that person can actually act in a leadership position with regard to safety of the environment. Leaders with titles and designation, though, often have unique access to resources and information. Resources can be money, personnel, equipment, what have you, and information, and also have different authorities and responsibilities. And so who is the named leader and the de facto leader might be the same person or might be someone different. But I'd like to ask you to look inward also, not just the external, not what leaders do, but who leaders are, and think about yourself as a leader. And try to reflect on who is this person who leads, and maybe even ask that question about leaders that you report to. We all know about their roles and responsibilities and titles, but we're a collection of human beings, and humans are complex. And humans have values and aspirations and roles and responsibilities. So just consider this question, not only for yourself, but also for others that you work with. So in order to help you kind of do this, I'd like you to take a few minutes and jot down some notes about a leadership challenge that you had in your role as a leader, either a titled leader or a de facto leader of a small clinical team, a class of students, a larger group, an organization. Just think about the context in which you have some kind of leadership role. Now, thinking about this challenge, consider what was particularly challenging, and maybe why that aspect was challenging for you. Try to unpack that a bit. Did it have to do with the nature of the situation? Did it have to do with the nature, the context in which you were working? Was there time pressure to resolve something? Were there people present or absent who were either helpful or unhelpful? And now consider what aspects were handled well, and thinking about your contribution to handling the situation well, but also think about the contributions of those in your team or in your environment who might have made a difference, have made a positive difference. And also consider what difficulties remain. And then again, as you're thinking and jotting some notes down, what did you learn about your leadership style? What did you learn about your strengths, your difficulties, your areas for growth? And maybe those learning points, that growing edge that you have, maybe that was apparent to you in the moment, but maybe that learning only becomes obvious to you in retrospect. I think for many of us, it often takes stepping back and just thinking through the situation and thinking, well, could I have seen the situation in a different way? Or in what ways did I make assumptions about the situation that either were true or untrue? Who was particularly helpful? Do you have a role model that you kind of channel when you're in difficult circumstances, thinking about how would so-and-so have handled this situation? But importantly, not only just being aware of your difficulties, but being aware of your strengths. Let's say you had a real advocate, a coach, someone who was really looking out for you. What would they say you're good at in terms of a leadership role? And just jot some of those things down. You know, what skills, what virtues, what attributes do you have as a leader? that you might want to build on. I'll give you another minute to just think this through, and then we'll move forward. Okay. So again, if we were meeting live and having a discussion, these might be some of the themes that might come up. These are things that participants in other workshops that we've run has said. And this is certainly not a complete list, but I think the starting point is showing up. Okay, it's being available, being present, and not only just showing up physically, but also showing up emotionally, showing up with your presence. And showing up is being attentive to those in your team is really a gift. I mean, it's a sign of respect, and it's a sign that you're putting people first, that you're creating a sense of community, and then within that sense of community, you're then addressing some of the problems and challenges that you might have. Good leaders seek opportunities to pause. Okay, so there's this difference between reacting, that kind of knee-jerk reaction. Someone says something and it pisses you off and you feel like, your blood boiling, and then responding in a way that's concordant with your values. So perhaps waiting a moment, thinking about what's going to move this situation forward. And so finding opportunities to pause that may or may not be directly apparent to those that you're with. But this internal sense of spaciousness, even when the heat is turned up and there's a sense of urgency. As Stephen Covey said, often we listen to respond, we don't listen to understand. So turn that on its head. Say, well, I'm going to listen to understand for a little bit. I think I know what that person's going to say, but I'm not 100% sure. Okay? And maybe that person will say something a little bit different. This question I find incredibly useful. Just asking someone, whether they're a patient or a leader or someone who reports to you, what's the hardest part? What's the thing you find the most difficult? If there are strong feelings, addressing them, at least acknowledging them, and then address actions. You can't always infer someone's intentions from their visible actions. Someone may have been intending to do something very compassionate and pro-social, and it comes off just the wrong way. Being realistic, credible, and trustworthy, that kind of goes without saying, but how do you know if you're trustworthy? In our department, every year, we engage in a kind of 360-degree assessment where you get comments and surveys from the people that you work with most closely. And sometimes the responses are predictable. They say things that you know about your own strengths and weaknesses, but occasionally there are surprises. And then I'm a skeptic about proclamations, about compassion, about teamwork, and I am more convinced by actions. So, and I think probably most people are that way, that proclamations are pretty easy, whereas consistently displaying and evincing compassion is a little bit more difficult. So think about yourself, what is it that you say, and what do people see you doing? And is there a split between those? So this was a survey done by Tate Schoenfeld, who used to be at Mayo and is now at Stanford. He's, got dozens and dozens of publications about burnout and is really probably the leader in the field at this point. So these are things that doctors say about good leaders. That leaders have an investment in your own growth and trajectory, career development. They're inspirational, and often inspirational by example rather than proclamations, is interested in opinions and suggestions, not that they will always follow my opinions or suggestions, but displays, because a good leader knows that they have limitations to their own creativity, and they can maximize their effectiveness by piggybacking on the creativity of others in the team. Providing helpful feedback, recognition. But recognition is more than just faint praise. It's specific. It's saying, when you did this, that was really exemplary and it had this effect on your patient or your colleague or the system. So the more specific, the better. Keeping one informed about changes and perhaps providing some rationale why those changes need to happen. And encouraging growth. It's as we discussed about resilience in the last session, as living, growing organisms, if we're not growing, we're dying. Okay, so we really do have that choice of moving forward towards growth and flourishing, or moving downward into despair. And I think that leaders can really encourage us, and you as a leader can also encourage the people you work with to develop talents and skills. And these qualities were directly correlated with physician burnout and work satisfaction. So what's the inner work? So we talked about showing up, but showing up is, I think, involves some degree of vision and vulnerability. Okay, when you articulate a vision, you also allow yourself to be vulnerable in the sense that some may agree and some may disagree with your vision. So that's it involves a certain amount of risk. Even if your aspirations are heartfelt, that there's always some risk to that. Know yourself. Again, I'm not the first to say this. Socrates, I think, coined that, and he probably learned it from someone else. So, but find some way to sharpen the saw, okay, to hone the tool, which is you, yourself, to tune your instrument like a musician, the instrument being you. And if that has to be formalized as 1 or 2 minutes before you actually plunge into work, even if you know that there's a traffic light that you stop at on your way to work, and what do you do with that time when you're waiting at the traffic light? Maybe just saying, how am I doing today? Mark Lesser is a really interesting guy. He, before going to business school, he was a very serious Zen student and actually ran a Zen retreat center for 10 years, and then saw the next step in his path as bringing some of those same leadership skills to the world. So he then started working with CEOs of large corporations, including Google. And one thing that he emphasizes in his book about mindful leadership is that you need to connect to, and listen to the pain that you're experiencing, that pain can actually guide you in the direction of more effective leadership. And as a corollary to that, to listen to, connect to, and learn from the pain of others. You need both. If you don't understand your own pain points, it's very hard to relate to others, and vice versa. Even though you might possess a lot of expertise, avoid being constrained by it. And that's the whole idea of beginner's mind, is that even though you may know your business, your profession incredibly well, the moment you lose the ability to wonder, to express your not knowing about, you might know a lot about a particular disease, but you might not know a lot about this particular patient with that disease. You might know a lot about organizational leadership in the abstract, but every organization is different. So this sense of awe, wonder, openness, not knowing, vulnerability, and leaders who evince these qualities also have the capacity to inspire others to step into wonder and awe. Actually, there's now a whole field of research showing the empowering nature of just experiencing some degree of awe on a regular basis. Depend on others. We are all interdependent and interrelated. And even if you are in a very powerful position, you depend on others to maintain that. And finally, this is probably the most difficult of them because it's so simple. That is, keep making it simple. Make your message simple, your speech simple, and perhaps your mind. So how can mindfulness help us be better leaders? What's the mechanism? What's the secret sauce? So emotion regulation. We know that people who practice mindfulness exercises experience exactly the same emotions as anybody else, but they tend to respond, they tend to recover much more quickly. Blood pressure lowers more quickly, heart rate lowers more quickly, sweating, tremor, all of those things that happen when you're under stress. They have the same height of the peak, but they somehow dampen a little bit sooner. Have a better ability to transform being furious into being curious. So that's emotion regulation, but also behavior regulation. The ability in that pause to say, what's going to move the world, this patient, this organization forward in the best way, and letting go of unhelpful behaviors. Emotional intelligence, self-awareness, social awareness. Being mindful also is a cognitive act. It allows you to be aware of your mind wandering and distractions just a little bit sooner so that you can bring back your attention to what matters the most. So mindfulness is not a state. Being mindful is actually this dynamic action of bringing your attention back to what matters the most, over and over and over and over again. No one resides in this state of perpetual calm or bliss or focus. No one. But the mindfulness action is the ability just a little bit sooner to bring the mind back to what really matters. Cognitive flexibility, adopting new perspectives, beginner's mind. And also just remembering that you may feel mindful and present, but others may not perceive you that way. So mindfulness is not enough. It also requires trustworthiness. People have to feel that you are up to the task, that you have ability, that you have integrity. And integrity is something that we can all talk about, but really has to be demonstrated. And also benevolence, that we are actually looking out for your well-being, not just our own. So leadership opportunities, in my experience, are not very predictable. They kind of come up sometimes when you're ready for them and sometimes when you don't feel you're quite ready. And for many of us, it's the latter, and it's just this invitation to step into a role that may be surprising, may come unexpected, may be initially unwelcome, and may initially be challenging. So I guess, I and many others kind of often ask ourselves these questions, like, why would I want to lead anything? I mean, leadership sometimes is not easy. So what are the motivations? What are the intentions? What aspirations would I have in approaching any new leadership opportunity that might come my way? What would I hope for from that? What are the most important values to me as a leader? What do I feel that I could communicate well? Under what circumstances would I want to or not want to be a leader, and why? I almost, at one point, took a leadership position as a chair of a department until I realized that there were some aspects of the organization that I was entering that I didn't think were fixable, and so withdrew. So asking oneself, what circumstances would I want? What are my strengths as a leader? How do I know that? And they're like 360-degree assessments or honest conversations with people who know you and care about you can be really useful. And how can you come to know those strengths more intimately? And that's part of the work that we're doing here and that we do in a much more intense and deeper way in our live workshops where we can actually interact with one another. A coach can be incredibly important. I mean, if you think about the most famous opera singers in the world, they all have coaches. The most well-known sports figures all have coaches. So, and that part of that is to help people learn their strengths. And what are your areas of growth? What's your plan to address those? So we've covered a lot of ground here in this last session about organizations and leadership, and also have covered a tremendous amount of ground in the previous 7 sessions. And just to summarize this session, organizations are communities of conversations. What we talk about is the reality that we create. Organizations themselves have the potential to be mindful, and there are several books about mindful organizations and mindful leadership, some of which are in your bibliography. We're all leaders, even if we don't think so. Others see us that way. And leadership starts with a vision and requires cultivation of those same qualities of mindfulness: attentive observation, curiosity, beginner's mind, presence, and probably a few other qualities. So here's the last home practice exercise, and maybe this is an exercise that's just not for the next week, but maybe for one's professional lifetime. Creating community among those you work with. Try to find something very simple, something that you can do with little effort. I at a certain point realized that I was always rushing into my clinical practice, and I was kind of barging through the door and going back to my alcove to get ready for the first patient, and realized that I didn't stop for a moment and smile and ask my staff how they were doing that day. And I mean, it makes perfect sense, and it kind of fits with my values, but in the haste of getting to practice, realizing that I wasn't cultivating the team that supported me. And clearly by changing that, it changed not only their attitudes towards me, but also my own sense of satisfaction and connection with work. So be aware of and include those who make you feel more whole, those who can offer you love, wisdom, or insight, or maybe all three. But also those who may challenge your worldview, people who care about you but see the world differently. And then also those who might not be part of your bubble. Think about demographics. Is your bubble largely one gender or one age group or one race, and thinking about the different perspectives that you could take advantage of and appreciate if your bubble was just that much bigger and more inclusive. And the last thing, remembering that mindfulness is about remembering. It's about remembering the right thing and orienting yourself towards that. Find a way to remind yourself, perhaps setting an alarm on your phone, whatever you need to do, a little sticky on your computer monitor, but try to remind yourself about the most important thing. So next steps, again, Mick mentioned that we can be available for workshops and consultations, that finding some way to practice on a daily level, and if you look in your printed materials, there are some organizations and websites that you could contact for some more of these mindfulness practices that might be of use. Reading other resources you can find on our website, and sometimes like-minded people in your community are in places that you might consider unlikely. So someone in a different department, different profession, etc. Keep yourself open to that possibility. So I'd like to just close with just a couple of minutes of quiet, giving you some time for reflection, for orienting your priorities for your next steps, about what you're going to do to try to make your professional life richer, and feel that you're thriving, flourishing, and able to do the work that's the most important to you. So let's just take a minute being aware of your body, your position in space, your feet, your ankles, your knees, legs, torso, shoulders, arms, hands, face. Just taking it in. And on behalf of Mick and myself, just want to thank you for participating. Just a couple small administrative details. You'll be getting some email reminders about CME credits, etc., and also a brief evaluation, and you'll be getting all that in your email. So it's been a pleasure, and want to wish you all well.